Hi, everybody. Welcome, everybody. We'll get started. I'll just quickly give an introduction about Creda Health to everybody, since some of you may be new to what Creda Health is all about. Thank you for signing up for the webinar, for participating this evening. Welcome you all. Creda Health is a health tech company. We help people manage chronic conditions, specifically heart disease, whether it's hypertension, high cholesterol, heart failure, and then associated conditions like diabetes, pre-diabetes, and obesity. We all know that nutrition and exercise play a very important role, in addressing all of these conditions. So that's where Creda Health comes into the picture. We help you. We have scientifically designed 30, 60, 90-day outcome-based programs that enable you to work with internationally certified nutritionists and fitness coaches, as well as physicians who walk you through your entire journey. And we sort of help you make step-by-step lifestyle changes which can last you. These are habit-forming changes that stick with you for the rest of your life. And there is also a digital health assistant in the app, which enables you to, which gives you guidance. The more information you give it on your medication, on the food you're eating, your vitals like your blood pressure, blood glucose, it keeps giving you a lot of information back, sort of keeps nudging you on what to do right and, how to fix certain issues that you may be facing. One quick example would be, this is a real patient story where a patient who had hypertension came into the app, added hypertension as a disease, added amlodipine as a medication, and after a few days said that they were experiencing leg swelling as a symptom. And the app was immediately able to give them guidance that the leg swelling could be a potential side effect of amlodipine. So, and recommended that this patient talk to their cardiologist about this. And the patient actually acted on the app's advice, and the cardiologist actually changed their meds from amlodipine to another class of drugs called ACE inhibitors, and the leg swelling subsided. So there's lots of real user stories like this in the app, which we will be sharing in the coming few days on social media, and you can see the app in action yourself if you download it. And of course, there's these programs that I spoke about, which handhold you through your entire disease journey. Having said that, we will get right into the webinar, but I'd like to quickly, give you some housekeeping pointers. We've taken questions after the presentation, and there are a lot of people who sent us questions, a few days prior to the webinar. Thank you so much for that. We'll try to get them, as many answered through Dr. Talwar today as possible. And without further ado, I'd like to welcome Professor Talwar. Thank you so much, for taking the time, and coming this evening to help us gain some more knowledge on heart health. And obviously, Dr. Talwar needs no introduction. He is a renowned cardiologist, a Padma Bhushan Awardee. He's been the head of Department of Cardiology at AIIMS, director of PGI Chandigarh, and currently is the chairman of PSRI Heart Institute. Welcome, sir, and hand it over to you. Thank you.
Thank you so much. So what is the, should I share some small presentation which will also address to some of the question which has been raised?
Please, sir. Yes, absolutely. That would be wonderful.
So can I share screen? Good evening, everyone. And as I hope I will be able to, some of the queries which have been raised or some other, those who have it, I hope I should be able to answer them to their satisfaction. So now, can I share the screen, Shweta?
Sure, please. Yes.
But you have to, it's disabled, so it has somebody, please.
Sure, I will just. You should be able to share screen now.
Okay, let me see. I'm not that very. This is the presentation. Is okay. Now, I'll briefly. I mean, I'll rather say that if somebody wants to ask question during my presentation, no harm, because this addresses to the some of the basic questions that have been raised. Now, I think I can say that the coronary artery disease or the heart disease, whether it's hypertension or diabetes, the consequences is because of a very unhealthy lifestyle. So this emerging, we call today epidemic of non-communicable diseases, the coronary artery disease, the hypertension, the diabetes, even stroke, and to some extent cancer. This is not a subject today. So it is mainly because of the diet issue, lack of physical activity, tobacco use, excess alcohol use, and of course, urbanization, changes in occupation, global influences, stress of the change, profession. These are some of the major factors that we call as the risk factor, which makes a person prone to these kind of diseases. Of course, there is some genetically proneness also, but it is mainly the environmental factors which contribute to this. Now, we call this as a risk factor which lead to these non-communicable diseases. Tobacco, I mentioned, alcohol, excess use, physical inactivity, dietary issue, and all this may lead to the body mass index, the overweight, obesity, high blood pressure, diabetes, hyperlipidemia or cholesterol goes up. And so these all then physiological risk factor lead to heart disease, stroke, diabetes kind of situations. Now let us take each one briefly as I'll try to be as in a layman sort of manner. Smoking is supposed to be one of the major risk factors. It results in coronary artery disease, first heart attack. If person doesn't stop, second heart attack can occur, cardiac arrest, sudden cardiac death issues. And those who are a bypass, if they continue to smoke, the bypass grafts also get blocked at the earlier time than I think the natural history that we see. If you look at these tobacco or consumption, I think they say 27% of the global tobacco production occurs in India, and about 6% plus is total utilization. Awareness of risk associated with the tobacco is need to be increased, and smoker need to be sort of identified and then advise how they can be sort of advised to leave smoking. E-cigarettes is as bad as smoking, and I'm happy that the government of India has banned it. I mean, you can't procure it, you can't market it. The government of India has been sort of trying to address this for the tobacco control. 75 acts was like statutory act, health warnings on cigarette packets should be there mandatory. Then tobacco control in 2004, prohibition of smoking in public places, advertisement, sponsorship, promotion of tobacco products were banned, and sale to minor and educational institutions. And then 2019 was the e-cigarette act, by which the sort of cigarettes were banned from being marketed, exported in the country. I'll just before, I mean, go a little further, I will like to mention this sentence, which I think is very, I find in practice has a lot of truth into this. The most unfortunate thing about this word is that good habits are easier to give up than the bad ones. And regarding smoking, when I was just finishing my graduation, in the Reader Digest, I started this statement, and which I think I'm talking of early 70s, which I think was so true, but I've seen over the years in my practice. It's easy to stop smoking, but difficult to stop starting again. It invariably happens. People say, oh, I've stopped it. And after some time, they again start. This is, I think, about the smoking. I always use this sort of sentence to my patient to remind them that it's easy to stop, but please make sure that you don't start again. Now, just briefly about the diet issues. Like avoid the vegetables and fruits, avoid vegetable with gravy, sauce, fried vegetables, canned fruit, processed foods. That also has because of the preservant that are used in that, that also are harmful. A lot of salt is used, sugar is used. So these processed food, I think, is now generally recognized that we should avoid processed foods. Take fresh vegetables and fruits, and the amount that is recommended WHO or the FAO is 400 gram fruits, vegetable daily. Vegetable and fruits are good source of vitamins and minerals, and they're also low in calories and rich in dietary fiber. And as I mentioned, that the quantity is mentioned to be around. Only thing is, I think this is, we know that why these cardiac problems are becoming more in those socioeconomic group is now, because these food items are expensive and people can't afford it. That's why they resort to what is cheap available to them. And that cheap has more of fried things, kind of, so those things sort of create more proneness to cardiac problem in the low socioeconomic group of our people. Now, as far as this is the quantity, I will avoid, but avoid white flour, white bread, bakery items, fried popcorns, and prefer whole wheat flour, high fiber cereals, oatmeal, maize, jowar, bajra. So these are kind of because they have a high fiber, and high fiber is supposed to reduce the blood sugar, triglycerides, cholesterol, LDL, which is we say bad cholesterol, and HDL is supposed to be the good cholesterol. I'll come to it. Reduce the body weight, and of course also useful to prevent some kind of a cancers. When you talk about saturated fat, some people are say that why not to use desi ghee? That and this common sort of many people say, oh, my father used to eat so much desi ghee, but he lived to that long age. I agree, desi ghee has a saturated fat. We can allow around 10% of the total calories. We must realize that those people, when they were taking saturated like desi ghee, they were doing a lot of physical activity. I mean, either walking or cycling. We don't have the facility those days of these kind of other vehicles like cars or scooters. So I think the physical activity, I mean, if you consume what you eat, it doesn't harm the body. But when you are not able to consume, that's why. So I think today the desi ghee you can take, but should have only less than 10% of the total calories. And of course, when we come to the oils, which oil should be used at home? That's, I think, very important question. All people say, so there are oil that they are monosaturated fatty oils, or they are polyunsaturated, or they are saturated. Saturated, I mentioned to you that we should avoid, only take less than 10% of the calories come from saturated fat. The monounsaturated fatty acids like olive oil, canola, rapeseed, rice bran, and krill oil, they are good. And oil which have a N3 is a kind of fatty acid, which like soybean, mustard, rapeseed, they are also good. But oil which have a high N6 ratio, I will come in the next slide, like safflower, sunflower, corn oil, cottonseed, they were supposed to be very earlier in the 70s, 80s. I mean, these became very popular because they don't have a cholesterol, so they lower your cholesterol. But the problem was their N6 ratio and 6 kind of fat, they were quite high. Now the ideal oil that we know should have a N6, N3 ratio around 5 to 10, and soybean, mustard, rapeseed, and these oils have a good ratio. Whereas the ratio in this polyunsaturated ash is more than 15 or 20. And that's why they are not good. You can combine sometime, but you should avoid using these oils. That is the now lesson that we have learned over the years. Of course, trans fatty acids are very harmful and one should avoid using those. I'll say that this is the saturated fatty acid, as I mentioned, increases the LDL cholesterol. LDL is a bad cholesterol. That's why we must limit the quantity of saturated fatty acid, and desi ghee comes into that. Monounsaturated, they low LDL cholesterol, they also low triglycerides. And polyunsaturated, they may lower LDL cholesterol, but they also lower the HDL. HDL is a protective cholesterol, good cholesterol. Those who have a high of this, it protects them from developing any coronary artery disease. So this also gets low. Whereas N3, like alpha linolenic acid, it reduces LDL, reduces triglyceride. This is present in the fish or other vegetable item also. I'll narrate those items. And trans fatty acid or hydrogen, like the bakery items, they sort of use the banaspati kind of ghee because the item can be restored for a longer time, but it raises the LDL and lowers the HDL. So it's very harmful. So I think this is what a little bit we know about the oils. And so fried foods are very popular. One should avoid frying oils undergo a change. If you mustard oil, we say that if you cook it again and again, it's bad. It may then have a toxic element. So that once you use it, you should discard it. Because there was a practice in the villages that earlier that, okay, because of the, you can say, resources limitation also, that you use this oil again and again, which people should avoid. And now fish, I said, has a good N3 as omega-3, and serving may help you 2 servings in a week, but I think fish is limited in our country. I think few places which may be okay, but like North, I think it's not a food item with the North people. But N3 is also seen in the other kind of these like flax seeds, bajra, wheat, black gram, lobia, rajma, soya. They also have a N3. Green leafy vegetables, methi or fenugreek, mustard seeds, and oil, mustard oil, soya. So they also have N3 acid. It's not that, so these items which are routinely used, I think they give you a good amount of N3, and fish, of course. Now about the nuts, I think there's always that, I think almonds, walnut, they are good. And the other like peanuts, also hazelnuts, flax seeds, as I mentioned, they have a good amount of omega-3, which is a good fatty acid and vitamin E. And so the use of nuts, those who can afford, usually cashew nut usually have some cholesterol fat. That's why it's not as good as almond or walnuts. And nuts have rich in healthy, as mentioned, omega-3, vitamin E. The plant sterols, lowers cholesterol, good in moderation. Raw and dry roasted nuts are okay rather than cooked in oil. I think that one should avoid. And fish, as I mentioned, that may be helpful. So I think they say about 4 servings of unsalted nuts a week, kind of 30 grams is per handful. So this may be useful. Those who can afford, they should try to use these kind of food items. The carbohydrate is bad, and I think we should have carbohydrate items which have a low glycemic index, like I said, high in fiber foods. So I think coarse, less refined, and coarsely ground, minimally cooked. I mean, these are the ways that you can preserve the fiber and that have a low glycemic index. There's always a concern when a patient has how much eggs he can take. You see, as far as the European recommendation is that people can use 7 eggs per week. But as per our National Institute of Nutrition from Hyderabad, the recommendation is that Indian 3 eggs per week. And we'll say, okay, you can have yellow that day, but if you want daily egg, take a white of that. You can take it daily. But as far as yellow, probably limit to 3 eggs a week. Basically, I've already mentioned the problem and also the trans fatty acids issue. So I'll just say that how we have been trying to, for the sake of taste, just trying our food. Roti se we went to naan, paratha, butter naan, boiled rice, we gone to pulao and biryani, steamed idli to idli with ghee, fried idli, plain dosa to masala dosa, ghee roast masala dosa, vegetable kofta to malai kofta, bindi masala, tomato rasam to cream of tomato soup, So I think even fish tikka, fish fry. So I think we have been trying for the sake of our taste, sort of trying to sort of what is healthy for the body. I won't say that we should not have some time, but occasionally is fine. But it should not be a routine kind of a habit. Alcohol consumption is another issue which common patients ask. I think moderate consumption, I'll come to it. Like we say beer about 360 cc, whiskey around 45 cc, wine 120, they do not harm. But if you go beyond it, I mean, I will say, suppose somebody has a heart problem, has a heart dysfunction, there we don't recommend at all. It's only for healthy people as a social drink. If you limit to this, it's okay, it may not harm you. I mean, but there as such, there is no benefit of alcohol to the body. There is some kind of, there was no alcohol is good for the heart. It is not so. Okay, it may give you little more relaxation of mind, but beyond that, nothing. So I think those who take it is fine, but those who don't take it, we do not recommend that you should start taking alcohol. Of course, those who take sleep slowly, alcohol has calories also, and never drink on empty stomach. And you take a lot of snacks along with that also are mostly unhealthy kind. So one should try to see how to balance it out. Then activity issue. I think this is a very important observation, which was in 1953, Lancet published this paper that they said even physical activity at work has a role to prevent coronary heart disease. The bus drivers were at a higher risk of cardiac event than were their more active conductors. So because they keep on walking, so I think that, so during work also, you should continue to do some physical activity. If you have to, in your office, climb stairs, don't wait for the lift. If you go to 1, 2, or 3rd floor, go sort of climb stairs. If there is some across some building where you sort of have to go for some work, walk if it is possible rather than using the car or scooter kind of thing. So I think routine activity physical is also have been shown to be helpful. And then I think this is another, I'm sure most of you must have heard it, that sitting is the new smoking. It is as harmful, smoking, and global death per year 5.1 million smoking, and inactivity is 5.3 million. So I think sitting is also like smoking. So the new smoking, so we should try to avoid, and we trying to be as physically active as possible. So physical inactivity leads to it may lead to hypertension, lead to sugar, obesity, and some load of genetics. So this may all cause coronary artery disease or stroke kind of issue. Of course, if you add smoking or other hypercoagulable states, these further adds to your problem. I think another fact is that current physical activity is protective. Don't feel that you have been a player, you have been playing a lot during your younger days. That's not going to protect you now. So wherever I think you must continue to do some kind of physical activity. And we do say that exercise results in weight loss, improve insulin resistance, I mean the better diabetic status, reduction of blood pressure. And so this reduction of cardiovascular disease in patients who are active physically or doing regular exercise. They say elite athletes have probably 67% lower mortality than those who are, I mean, as compared to other general population. So walking, I'll say the simple, easy to perform, doesn't need any money, material, or membership of a club. You can walk wherever you, I mean, I'm sure maybe places are daily. I realize there may be problem in some of the colony. People have to have some kind of insight, possibly exercise. And exercise for around 150 minutes in a week. 30 minutes at a time, 5 times a week is minimum. But if you can do it daily, it's fine. And yoga, meditation, I think they say exercise adds not only years to life, but also life to years. So I think these are about the exercise. As the exercise paradox, I like to mention that generally there has been reported some kind of a heart attacks and death. This recently, some of the celebrities while exercising gym had a problem, and there was a lot of noise in the media. I think what has been seen, In young athletes or old individual, I mean, in young athletes, we say they may have some underlying problem. So it's important they should have some type of cardiac evaluation, ECG useful, and these are mostly inherited issues. If there's a family history of a sudden death or some problem, the person, younger people should be careful before they resort to heavy exercise to get properly screened. And older individuals, apart from, and these are usually seen on younger people, the exercise test may be considered because it has been seen that two-thirds of individuals with sudden cardiac arrest during the exercise, but they have a prior symptom, they have a prior disease. Some of them know, some of them may not even know. That's why a proper cardiac evaluation person may go through when you are trying to join these kind of a gym exercise or other exercise protocols. Yoga is important for improving muscle tone, but so I think yoga and exercise to be combined. You must have physical walk kind of thing, plus do yogas. I think they both have a very complementary role to keep the body healthy. So I think that was, they say that somewhere we went terribly wrong and we are at this stage now. So anyway, even with the growing age also, for elderly people also getting old, for everything, usually lack of activity, I think we should exercise at any age. Human body improves with activity regardless of age. I think this is one issue which we do find younger people coming who are in the corporate sector. There's a lot of stress in the work. People not sure about they have to produce the outcome results. And say this is a issue, but I'll say, and it's the integral part of life. Everybody has ups and downs. Positive attitude helps. Be optimistic. And I think today, nobody can, if you want to grow in life, in career, stress is a part, you have to face it. So you have to virtually train yourself that how you can sort of cope with the sort of stress that you might have to go through. And these are some of the, I think, points that I like to share that probably we feel that do help in reducing stress. Exercise regularly, try to relax, learn to relax, take a break, talk it over. They say it's very important. And recently, I think in WhatsApp, somebody sent a message, which I thought was very interesting. So the message wrote that I think somebody was talking to the corporate sort of a group, youngster who were sitting, just how to take care of stress. तो उसने कहा कि कोई एक शेर लिखा हुआ था एक हार्ट सर्जरी के थिएटर के बाहर कि अगर हम दिल खोल लेते यारों के साथ तो नाक खुलाना पड़ता औजारों के साथ. I am sure some of us you must have read it or so, but that only emphasizes, please talk it over. I know you cannot talk something confidential to everybody, but do have some people that you can share with. And that does reduce your stress, probably improves your how to handle the stress, plan your work, be realistic, be religious. I think this also I feel help if you go to a temple or Gurdwara or a church. When you are there, at least your mind is relaxed. You have to pass on some of your stress to that. I think these are ways one has to train oneself to face stress because they say all days are not same. You I think दिन के बाद रात के बाद दिन आता है सभी के लिए आता है तो ये थोड़ा सा concept life में ठीक है. It's right that some people go through more, some people go through less, but that's I think beyond our control. So solution to our conflict and confusion is developing some kind of spiritual attitude to life, which I said I call these are spiritual habits, which helps you to take care of stress. So think of others and work for their welfare. That also when you do something for others, it gives you a lot of good feeling inside. Honest and true in dealing with it. There has been some observation, scientific observation, people who have been trying to be cheating their colleagues or have been unfair to them or have been, they usually get more heart problem than those who are very sort of honest in their heart. So that's important. Look beyond the material package. Suffering gives an opportunity to personal spiritual growth. I think, of course, all religious books. Cholesterol, I think screening we do advise everybody, man below, above the age of 40, woman maybe 50, but should have a screening for the lipid profile. Whether you need to take care of cholesterol, if it is not that you can handle by your lifestyle, then you might have to take medication. And if you have 2 or more risk factor, like somebody is hypertensive, has a diabetes, maybe 30, you should have a lipid profile, or somebody with heart disease or other vascular disease or family history. Those who are normal, asymptomatic, I think are beyond the age of 40, everyone, every 2 years should have a lipid profile screening. I think I can skip these issues and just to say that there is always how much I should keep my cholesterol. And we say LDL, which I mentioned is the bad cholesterol. So if somebody has no disease or low risk, can be LDL of 120 around is okay. But if somebody has a moderate risk, is diabetic or some hypertensive, and so I think you might have to see that you bring it below 100. But who has a coronary artery disease below 70 and who have more severe disease, maybe below 50. Now it is that even the lower it is better. So I think these are the kind of, because people do ask what should be my LDL, when should I take the medication for this? This is another area which I think to me looks very attractive and I think has a lot of merit, but something we have to learn more about it. And that's heart and gut axis. Connection between our gut and heart, effect of gut microbiome and microbiota derived molecules on heart and vice versa. The intestinal microbiome is increasingly recognized as a regulator of metabolic pathway in the host. Change in composition of the gut microbiota has been associated with pathophysiological result may atherosclerosis, hypertension, obesity, cardiometabolic syndrome, which also the diabetic is part of the component. So this is area which I think we are learning more. I only say that probably I think we need to be sure that what we eat, we take care of our gut. We do not let, because there are certain insults, I'll say, now how we affect our microbes in the gut, unbalanced diet, some bacterial or helminth infections, and sort of uncontrolled, I mean, suppose some people have constipated, you have to take care of how you affect take the health of your gut. Drugs, chemotherapy, antiviral, radioactive isolate, all these drugs may also affect your gut. So I think you have to be careful, don't drug yourself unless it's needed. Because overtaking medicine, thinking that, okay, these days there's a lot of habit among people like proton pump inhibitors. Everybody has a gas problem or gastric. People take a lot of proton, this pentosate kind of a salt. But they also affect the normal microbes. If you take it beyond a period, take it for a short period of time, 4 weeks, 6 weeks, and give a gap. So I think these are some of the issues which I think we are learning more. I don't think that I can tell you that how we can take care of our gut microbiomes. And I don't think the data is there that if you take probiotics, it might help you that much. There is no significant data on this, so I will not advocate the use of probiotics. So I think as far as I'll say that what we should briefly therapeutic lifestyle that we call, become physically active every day, limit alcohol, sugar, excess salt and caffeine, avoid tobacco use in any form, whether it's a BD, smoking, cigarettes, tobacco chewing in the pan and all that. People don't realize that it's also has a same harmful effect. And adopt healthy diet. As I shared with you some of my observations, ideal weight, base hip ratio particularly is very important, and manage your stress. And of course, if you have a disease, high pressure, sugar, diabetes, hyperlipidemia, you must take the right medication, optimum medication, and to take care of these things so that they do not create a problem for the heart. So love your heart, and thank you so much. I am open that there are some questions, Petrikaji, that I have sent me, or whether if some people like to ask first question, I can then later on go through. Thank you so much again for all. I think, should I stop sharing? Should I close it now?
Sure, sure. We'll start taking questions, Dr. Talwar. Thank you so much That was very insightful. That's the first time I've seen, a physician or a cardiologist connect spirituality with heart health. So my key takeaway is be honest in your heart if you want to keep your heart healthy. I think that's a very big takeaway. And of course, share with your friends, talk out as much as possible, all your worries and stress. And I think a lot of us in India are guilty of self-medicating. So I think that's also another key takeaway, that don't self-medicate with antibiotics. Don't keep popping antibiotics as soon as you have a sore throat. I'm guilty of it. So that's another very insightful thing. Thank you so much. There's some questions that people are sending us live right now. And there's questions, that have been sent before.
You can see in the chat box.
Yes, we can see. There's
should I try to read them?
Sure, I can read them out for you. So any more questions people want to ask live, please let us know. You can raise your hand. We'll allow you to unmute yourself and you can also ask them. I think, so let me start with Mr. Rohan Chandrasekhar. He's asked question. In the news lately, we've been hearing of seemingly fit men having heart attacks during a workout at the gym. They look to be in peak physical shape, yet are succumbing to heart disease. Why is this so? I think you did cover that a little bit. Would you want to talk more on that a little more? Hello, can you hear me?
Yeah, sorry. So I think that maybe the person is not aware of that he may have an underlying problem. That's why you say any person beyond the age of 35, 40, when they want to, if they've not been regularly exercising, they must get a kind of a cardiac checkup done. Because that's the only way that, and the second thing we do advise that people who has any kind of a heart problem, that avoid isometric exercises. For example, lifting weight. Lightweight is okay, lifting weight, pushing something, those exercises are not good for the heart. Aerobic exercise like on the treadmill or bicycle, they are fine. I mean, that's for those who are going for the gyms. Otherwise, those who are going on open exercise, walking, on light jogging is fine. But these people, those who when they join, they must get a cardiac checkup done. If they have an underlying, like we do a treadmill, we give a person exercise, that's under controlled environment to see if he has any proneness to cardiac problem inside. So these things should be, I mean, probably what has happened to some people, maybe they were not aware of. Another thing, I think we learned that in some of the gyms, they give some powder. Some kind of, they say protein and all that. I'm not sure whether it contains some steroids or something, muscle building. So I think people should avoid that. I'm not sure, but that's another issue that we sometimes take. So this is what I'll say on this subject. But if there's anything more, I can clarify. Can people can ask, they can also join, or they can ask questions.
Thank you, Doctor. I hope. Sure. Sorry. There's another question. Do carbs and fats affect the heart in the same manner or in different ways?
Sorry, I am not. Can you repeat this, because there was some disturbance?
Are you able to hear me now?
Now better. It's better.
So another question from the same participant: do fats and carbs affect heart health in different ways?
No. You see, fat, as I mentioned, that is, if you take unhealthy kind of fat, it only get added to your cholesterol. So that's why the fatty item that you use, you must make sure they are the healthy kinds, so that your LDL cholesterol does not go up. I hope it is. Hello?
Yeah, we can hear you.
So this is mainly because of the cholesterol issue. And then also, if you take too much of fat, it adds to your weight. So you have to limit to around, they say 30%, 25% of your calories should come from total fats. But I am sure there are many diet fads going on these days. this kind of diet, that kind of diet. I think it's very difficult sometimes to, because we have to go by what is scientifically proven something.
That makes sense. Thank you, Doctor. Another participant sent us a question, yesterday. They say I'm 57 years of age. In 2018, an ECG finding came as right bundle blockage. After further examination like TMT, ultrasound, heart, no abnormality detected. How should I take it now? I'm a case of mild hypertension and taking amlodipine 5 milligrams.
See, as far as right bundle branch block, this is can be as a benign. If you do not have any other problem, you have got it evaluated, perfect. Don't worry about RBB alone. Right bundle branch block, only thing is get your regular screening done every year or 2 years kind of a thing. Because in some people, occasionally it may progress, but right bundle branch block as such is no disease and people should not worry. We feel that you just relaxed. So long other things are okay, but screening every 2 years or so or 1 year or so, or any symptom, then you should. But otherwise, right bundle branch block doesn't have that kind of a issue.
Thank you so much. I hope, Mr. Vikas, your question was answered. There's another question that came in, which says, for someone who is a naturopath, do you recommend any natural organic supplements besides a healthy diet as opposed to pharma drugs like statins that can help reduce LDL levels?
No, as far as the natural items, if I rightly understand, I mean, like we say flaxseed, fenugreek or methi seeds kind of a thing, even garlic, these are known to lower the cholesterol. It all depends on whether by your healthy lifestyle and food, you can bring it to the desired level. But suppose it is still high because cholesterol has two, one is an exogenous that we eat, and another is endogenous that the body produces itself. In some people, endogenous production is more. So I think in those situations, those who have a high level, in spite of taking all precaution, they take very healthy food, they take physical activity. But if still it is high, it means that your body is producing more because of certain enzyme issue in the body, which may be less. And so medication may be useful in that stage. What is the level of LDL? These natural items you should adopt as a first line. But if you're not able to bring it to the desired level, then we have to resort to medication.
Thank you, Doctor. There's another question. It's a little detailed question from Mr. Sayal, who's attending the webinar today. Completed around 29 years of bypass surgery, CABG. I'm now around 81 years old. TMT tested positive. Don't intend on going on any further surgery. Feel chest heaviness on walking sometimes in the afternoons. Medicines prescribed are Dilzen CD90 or Tazlog 40, Sorbitrate GT and Sorbitrate 6.4 milligrams, Flaviton, Ditor, Ranolaz, OD 1000. Regularly on these medicines last 3-4 years, weighing around 70 kgs, 5'9" height, quite regular in yoga, breathing, and other exercises. Also daily 1.5 hours of workout. Knee replacement is also advised but not going ahead because of heart condition. Request your valuable feedback in the matter, particularly on the medicines I'm taking.
See, as far as I have this question in front of me, I'll advise, number one, that in the medication I find Dilgem is being taken. It's a calcium channel blocker. And he's also taking Ditor. Ditor is a diuretic. We usually give it to a patient who has a LV dysfunction, maybe mild or moderate. So if he has a LV dysfunction, that's why he's on Ditor, he should not be taking Dilgem. That is a negative to the heart if somebody has a LV dysfunction. So one thing is that he needs to be, his drug need to be looked, but there is some kind of a, why should he be on Ditor? and Diljam both. So that is one issue about the drug. I'll advise him that he may discuss with his physician, or uh, that's one observation that I have from his record. Number two, now his TMT is positive, but we do not know what is the degree of positivity. Is mild positive, moderate positive, or significantly positive? Because that has importance. If it's mild positive, no problem. He can continue with medication. If he's significantly positive, and sometime there may be ECG changes resting in these patients, those who have gone bypass, and doing TMT may be false positive also. So such situation, if we have some discomfort, we do either stress echo or stress thallium kind of a test, because they are more sensitive than TMT alone. So I'll say, and the degree of positive, mild positive, one can continue with medication. So these are the few things that he needs to little look into. But if his symptoms are mild, I think he's doing well with medicine. He should continue. He's on many drugs. But I have this little concern from my side about Diljam and Ditor both. So what is the LV dysfunction, LV echo, LV function क्या है वो हम LV erection fraction कहते हैं कितने % है. अगर वो normal है, then why is taking Ditor? If it is abnormal, then she should not take Diljam. He should take other drugs which are heart friendly. So that will be my small observation from this. And if he has, you can give him, you can write to me, send more details. I can get back or get back to you.
Mr. Sayal, I hope that answered your question. And we obviously have your contact. We'll get in touch with you if you have any more clarifications. We'll connect you with Dr. Talwar. Thank you, Doctor. There is another question, which is, Dr. Sir, please tell me which one is less harmful, beer or wine, if taken once or twice in a month for a person having type 2 diabetes and a stent in heart. And they have a follow-up question, what should be the minimum quantity one can have?
Well, medically, we feel wine and beer both are same. Is a quantity. At a time, as I mentioned in one of my slides, beer should not be more than 360 cc at a time. Wine should not be more than 120 cc. So the quantity matters at a one sitting. And so it's not that I only take once a week or once a month, I can consume more. No. At a time, you should not go beyond that, which is recommended as a safe kind of quantity.
Mr. Hemant, I hope that...
And sorry, just to add, if somebody has a heart dysfunction, we call left ventricular ejection fraction, if it is low, in those situations, we always advise not to take alcohol at all. So it will depend upon if he has anything or not like that.
Right. Thank you so much for that. Next question is by Ms. Rekha Kumar. Dr. Talwar, I'm 64 years old and having type 2 diabetes with issues with my L4 and L5. I've started taking whey protein powder. Should I take it or not?
This whey proteins, well, so long I'll say you're keeping your sugar okay, cholesterol okay, other your kidney functions are okay, or liver functions are okay. I think it may not, if it has been advised to you, but you should look at that you have those parameters okay. Like somebody has a kidney issue, creatinine is a little high, you should say how much protein you should take. So I think it will depend upon the general total situation. But I think one item I must say for particularly the pain, vitamin D we often ignore these days. We should not. Vitamin D is one which is now helpful if you have to control your diabetes, to control your hypertension, control your lung issue if you have asthmatic issue. So vitamin D has a receptor in all the muscles. Like anybody who takes statins for the cholesterol, we always say do take vitamin D. So vitamin D estimation and seeing if it is low, to take that whatever is required to bring it to normal range. and also continue as a maintenance. I think is the last some years now we have realized that we have not been giving importance to the vitamin D kind of evaluation. So we should.
Is there a doctor? Is there a different quantity difference between how much vitamin D should men take versus women take, or it's the same dose?
No, you have to go by the normal range. Calcium is okay in women and males. We say the female should take calcium beyond the menopause age. Male, we don't recommend usually, unless somebody has a low calcium. Vitamin D, you should take, and you must monitor by your blood levels that you are in the normal range. So that depends upon the, doesn't make a difference for the sex.
Okay. There's another question. Hello, doc. I'm sorry, 1 second. 41 years old. Vital stays low on bone health. Taking uprise D3 60K once a week.
Sorry, what is the 41 age, and sorry, what is this?
They're taking uprise D3, which is
uprise D3. Okay.
60K once a week. What is the recommended dose?
You see, if somebody has a deficiency, depending upon when you do your blood test, you know what is the normal range in the lab. And then if you have low, then we say take once a week for 8 weeks. Okay, that usually should bring it to normal range. After that, you should take once a month, like 2000 units of vitamin D per day. And 60,000 comes into 1 month. So one tablet is 60,000. So we usually say if they have low, take once a week for 8 weeks. Maybe you take a level again. If it has come to normal range, then take a maintenance. Some people may need twice a month, but mostly maybe once a month. So it's a question of once you have optimized your level by 8 weeks course, after that should not continue once a week. That will be hypervitamin problem is also not good. That can also harm organs. So make sure that you just don't take it lightly, that you continue at once a week. That probably will give you much more benefit. It's not so.
So you'd recommend doing some blood checkup, blood test after the
blood test before you start taking. Just have your idea where you are. Suppose somebody has in the normal range, then he only has to take maintenance dose. Okay. But suppose somebody is low. Most of us have a low vitamin D. Right. So normally we have to take for 8 weeks to bring it to normal range, and then once a month or twice a month, depending on what kind of level is there after this loading kind of dose, that 8 weeks that I mentioned.
Makes sense. I hope that answered your question, Mr. Goswami. There's a few more questions that were sent in to us. One was how to check heart blocks and treat the issues. This is more generic. So hypertension and some of the heart diseases don't have any symptoms. So how can one be aware of heart blockages or issues? Should they do regular testing, and what would be the prescribed sort of intervals of testing?
You see, as far as first hypertension that you just mentioned, that's why it is silent disease. So you have to get it recorded, and should then periodic recording. If it is normal, then it's fine, but sometimes because person may not get symptom, it may be high. So it's only recording will tell you. As far as the heart block goes, these are kind of we call it arrhythmic disorder. But that will be only if you have any symptom, get your ECG done and get checked up properly. Or you may do a routine ECG like health checkup, or as far as sometimes during routine checkup, you might find some abnormal. That's why everybody, like why insurance people do every evaluation, do ECG, or you have to join a job, they do ECG before that. So routine ECG might pick up something which you may not be aware of, number one. And number two, if you have some symptom like you have fatigue feeling, you have some giddiness or some occasionally giddiness or even slight fainting. So these are some of the symptoms which might alert you that, oh, I hope there's nothing wrong with the heart rhythm. And so a proper evaluation ECG will help to guide you what should be done.
So is there a regular interval, doctor? Because now we're seeing that heart ailments are happening with people of all age groups. So should we get some sort of echo test or some tests done after a certain interval, once in every 3 years, or or is it case by case basis?
See, as far as that's why this preventive cardiac evaluation has become, many hospitals have these kind of facilities. So I will say everybody around the age of 30, 35 should have ones, like you have blood profile, you have your ECG, you have your echo done, kind of a thing. And maybe above the age of 40, or somebody who has some risk factor, has a blood pressure or has a diabetes, high cholesterol or family background, had your stress TMT or stress echo kind of thing. So these regular evaluation, that's why these healthy cardiac checkup packages are there most of the hospital. Even the government of employees or the class A or I think B also, they all have to have a every year before they file their ACR, they have to have a card checkup these days. So this is mainly as a preventive to pick up something at the early stage.
So you would recommend at least an annual checkup up to the age.
And then those who are normal, I think then you do it every 2 years as per the blood profile goes. Now, as far as the stress echo kind of thing, if you're okay, you can do it after 2-3 years kind of thing. Is it kind of how, or if you have any kind of a little symptom that raises doubt, then.
We're on the top of the hour. We'll take a couple more questions, Doctor. Just there's some follow-up questions. Can somebody who is diabetic take sugar-free Chyawanprash? And does vitamin D deficiency affect heart health? So these are some questions.
No, Chyawanprash is fine. I think you can, sugar-free Chyawanprash is fine. That's good. It's a healthy food. No issue. One should take. And so there is some question I can see that does vitamin D deficiency affect heart health? They mentioned that those who have a low vitamin D, I mean, blood pressure issue, diabetic issue, they get more prone. And of course, we usually recommend vitamin D when you are taking statins for the cholesterol issue.
All right. Any more questions, participants? We'll take a couple more questions and we'll wrap up.
Sure.
Yeah. There's a tech question, Doctor. This was sent to us earlier. How and by when may we develop an affordable artificial heart?
I think it's a one very important question, but very difficult. As far as the total artificial heart, even we don't have it really. We have a LVAD, we call left ventricle assist device. We don't have a total artificial heart. There have been some going on, and to develop this kind of thing, implantable total heart, we still don't have in kind of a clinical practice. They are under all experimental kind of observations. And as far as affordability issue is going to be further, first we should have it like today, LVAD we call left ventricle assist device, which may help some individual, both as a destination therapy sometime we use, or we use as a bridge to transplant. That transplant is not possible immediately, give that so that he have another 2-3 years and then transplant can go on. The cost of the LVAD today is nearly 80 lakh. So I think you can sort of see these things are technology. I'm sure when you have more such things coming or indigenous, there are attempts going on in the country, a couple of institutions to develop these kind of devices for the heart. I think the price may then change, but at the moment we are on this stage. So I don't think affordability is a very difficult. What may be affordable for a billionaire is different. What may be affordable for a sort of, depending on his economical status.
That's very true. Yeah, there's a lot of. We hope that as part of the Startup India program, more startups build affordable health solutions. Yeah.
No, I think this Honorable PM Saab, so this Make in India, I'm sure at least we have started.
Yes.
That we have to sort of indigenize things, and I'm sure it take time, but that will be really helpful to create impetus to the industry.
Okay. So I think there's a comment. One most important thing, which is the recommended hospital in case of any heart issue for a middle class family in Delhi NCR.
I'll say you should go to AIMS.
Right. Yeah. Right. Thank you so much, Doctor. I think before we leave, just wanted to tell everybody thank you for joining. Thank you for taking out time, and of course a big thank you to Dr. Talwar for giving his invaluable time to us and answering questions. It was wonderful to have you, and lovely presentation, Doctor. Thank you so much.
Thank you so much for this opportunity in a way to interact. Thank you.
Thank you. And you really inspired us with the, I think a lot of us are going to take some inspirational key takeaways from your presentation. So thank you so much. And I just want to quickly tell people before we leave that, Creda Health can actually, help you manage your heart health. Again, we have, scientifically done programs. Dr. Talwar is, one of our advisors. We are going to have many more such webinars. So please stay tuned in. Do check out the Creda Health app. There's a lot of valuable information there. There are programs that can help you through your chronic condition journey, especially heart health. There is a whole care team that's waiting to help you, through any issues you may have. So do check out the app. We will share the recording of this webinar with anybody. People who did not register for the webinar, there is a link here where you can sort of give us your email ID and we will send you a recording, just in case if you didn't register. So again, thank you, everybody. Thank you so much. Thank you, Dr. Talwar, once again. This was wonderful.
Okay, thank you so much. Okay, Shiv. Thanks.
Thank you. Have a good evening.